Tryptophan has been shown to help to alleviate anxiety, depression, ADHD, seasonal affective disorder, obsessive compulsive disorder, PMS, memory loss, and pain. It's the sole precursor of serotonin. L-tryptophan's role in brain serotonin synthesis is critical for mood, behavior, and cognition. Serotonin is often referred to as the happiness molecule. Low serotonin levels can result in pain, insomnia, depression, seasonal affective disorder, and chronic fatigue. For your body to manufacture serotonin, it needs an adequate supply of the natural amino acid tryptophan. As a nootropic supplement, tryptophan is used for anxiety, ADHD, depression, insomnia, memory loss, pain, and eating disorder. A lack of bioavailable tryptophan in the body can have a big impact on your life. Tryptophan is an essential amino acid and it's needed to synthesize serotonin, and this plays a role in mood, sleep, learning, and appetite control. Low levels of tryptophan and serotonin imbalance in the brain are associated with ADHD. Studies have found children with ADHD have 50% lower than average levels of tryptophan. Low levels of tryptophan can result in short and long-term memory loss. Supplementing with tryptophan has been found to improve memory in healthy adults. Tryptophan is an essential amino acid and a precursor to serotonin, melatonin, and niacin, or vitamin B3, in the body. The enzyme tryptophan hydroxylase converts the tryptophan into 5-HTP, or 5-hydroxytryptophan. The decarboxylation of 5-HTP to serotonin is dependent on the presence of vitamin B6, also called pyridoxal 5-phosphate. The further conversion of serotonin into melatonin requires the presence of SAMe, or S-adenosyl L-methionine. Tryptophan is found in foods like oats, bananas, dried prunes, etc. Eating food that contains tryptophan can increase levels of this amino acid in the body, but not necessarily boost serotonin levels in the brain. Tryptophan is one of 8 essential amino acids, and it has the lowest concentration in the body of all the amino acids. Tryptophan requires and it competes for the active transport to the brain, and it competes for the same receptors as other amino acids. Research has also found that serotonin levels are enhanced by carbohydrates in the meal, because insulin release accelerates the serum removal of some of the amino acids that tryptophan is competing with. And if your meal has a high percentage of protein, it also slows serotonin elevation in the brain. Since protein from food has issues working its way into the brain to make serotonin, why not skip the step and supplement with 5-HTP instead? Tryptophan and 5-HTP both penetrate the blood-brain barrier, and 5-HTP is the intermediate step in the serotonin synthesis. Tryptophan's main nootropic mechanism of action is as a precursor to the neurotransmitter serotonin. Other neurotransmitters like melatonin and beta-endorphin also increase following tryptophan supplementation. Research shows that tryptophan and serotonin play a significant role in memory. Enhanced brain serotonin has been shown to improve cognitive performance in animals and humans, and decreasing levels of serotonin through tryptophan depletion can impair cognition. A study in Pakistan assessed the memory in rats following tryptophan administration. The rats received tryptophan doses of 50 to 100 milligrams per kg of body weight for 6 weeks. The study showed significant improvements in memory of the rats following both doses of the tryptophan. As a precursor to serotonin, tryptophan can have a significant effect on mood. Supplementing with tryptophan has been found to increase not only the serotonin, but also growth hormone and prolactin. Researchers infused 11 healthy male subjects with doses of 5, 7.5, and 10 grams of tryptophan, and then monitored their hormonal and their behavioral response. Tryptophan produced significant effects on mental and physical sedation, but it didn't increase the levels of tranquilization. Tryptophan provided a calming effect without knocking these guys out, even at the high doses. As we get older, our brain chemistry and our energy metabolism changes. Tryptophan levels decline. Tryptophan hydroxylase levels decline. Stress and insulin resistance increase. Magnesium and vitamin B6 levels decrease. Neurotransmitter levels decline. Concentration, working memory, and executive function decline. Appetite regulation, energy, and alertness also decline. All of these changes can happen at any age, and they're influenced by declining tryptophan levels. Very little dietary tryptophan is available for protein and serotonin synthesis, and for many people this can be a problem. Anxiety, depression, ADHD, memory loss, binge eating, and a host of other mental and physical issues have been correlated with low levels of tryptophan. Just living in modern society seems to have left us irritable, stressed out, and anxious. Worst case is problems sleeping, depression, aggressive behavior, reduced motivation, pain, and even suicidal thinking, and all have been traced to not enough serotonin in the brain. Serotonin, the happiness molecule, relies on an adequate supply of tryptophan for its synthesis. Researchers now recognize the role that serotonin plays in psychiatric and behavioral disturbances. Tryptophan hydroxylase is the rate-limiting enzyme needed for serotonin production, and it's involved in the conversion of tryptophan to 5-HTP. This enzyme, the tryptophan hydroxylase, can be inhibited by stress, insulin resistance, magnesium or vitamin B deficiency, or with increasing age. Tryptophan and 5-HTP can penetrate the blood-brain barrier, but tryptophan requires active transport, and it competes for the same receptors with other amino acids like tyrosine, phenylalanine, valine, leucine, and isoleucine. To complicate things even more, serotonin levels are enhanced by carbohydrates in the diet because insulin release accelerates serum removal of the amino acids that compete for the tryptophan transport, and high levels of protein in the diet slows the increase in serotonin. Many try the L-tryptophan for the first time to cure insomnia and as an alternative to prescription sleep medication. Dosing the L-tryptophan in the evening will typically ensure that you feel great the next day. You should have more energy for working out. Anxiety levels should decrease. Happiness should rise. Tryptophan can help with memory. Music can sound better. Feelings of self-esteem can improve. Some users report being able to taper off their prescription antidepressant medication by supplementing with tryptophan. 5-HTP and tryptophan are natural alternatives for the treatment of depression, and they're often used as alternatives to prescription antidepressant treatments because they don't come with the side effects associated with the antidepressant drugs. Much of the research looks at finding out if low levels of tryptophan are associated with depression and poor cognition, but there's very little clinical evidence that supplementing with the tryptophan will help to reverse low tryptophan levels, or if adding this nootropic to your diet will boost cognition. Researchers at the University of Queensland in Australia decided to comb through the research to find out if clinical trials support the natural health claims of using 5-HTP or tryptophan for depression. The team located 108 trials, of which only 2 studies involved a total of 64 people, had sufficient data to qualify. The team concluded that there's very limited data showing the 5-HTP and tryptophan could be better than a placebo for alleviating depression, so larger studies would be needed. 20 patients in remission or partial remission from depression were studied in a double-blind crossover trial. Tryptophan was artificially depleted in these patients, so scientists could look at the effects on cognition and mood. The research team found what you see in real life. Low levels of tryptophan had a negative effect on mood, their ability to process positive information, and their attention. Serotonin has been recognized as the neurotransmitter that's key to managing depression for at least 30 years. Most of the prescription drug therapies for depression work by raising serotonin levels at the relative synapses. We also know that tryptophan is the intermediate precursor to serotonin in the brain. So researchers use a what came first, the chicken or the egg approach, to decide if low serotonin levels or low tryptophan levels were to blame for the depression symptoms. Researchers in China analysed the levels of tyrosine, tryptophan and serotonin in patients with major depressive disorder, and they found that all three were decreased in patients. Note, tyrosine is a precursor to dopamine. The Centre for Addiction and Health in Toronto concluded a randomised, double-blind, placebo-controlled trial on 30 depressed individuals treated with Prozac at 20 mg per day, 2 to 4 grams of tryptophan per day, or placebo for 8 weeks. Mood was assessed using the Hamilton Depression Rating Scale and the Beck's Depression Index during the trial. During the first week, there was a significant decrease in depression in those who used the Prozac or the tryptophan. At 4 weeks, the research team recorded a disruption in sleep pattern from those using the Prozac or placebo, but not in the tryptophan group. The team concluded that combining the Prozac with the tryptophan was a safe protocol for treating depression. Patients experienced a rapid decrease in depressive symptoms, and the combination had a protective effect on sleep patterns. However, if you want to try this at home, you should be monitored by a doctor, as too much serotonin can cause serotonin syndrome. If you increase serotonin too much, you put yourself in real danger of serotonin syndrome. This can lead to all kinds of nasty side effects, even death. You shouldn't combine tryptophan with antidepressant medication unless you're doing so under a doctor's supervision. Ever wonder why you cut a workout session short, even though physical fatigue wasn't an issue? Researchers found it could be due to low tryptophan levels and its effect on serotonin in your brain. 20 healthy young men aged 21 years used a cycle ergometer at about 50% of their physical capacity for 10 minutes, followed by maximum intensity exercise for another 30. This sequence was repeated 3 times, and after the 4th series, each participant continued at the highest speed that they could sustain for 20 minutes. The protocol was performed twice, once with and once without tryptophan. The researchers found the peak power output during the last 20 minutes were higher on the trials performed with the tryptophan than those performed with a placebo. Another trial in Spain recruited 12 healthy sportsmen who ran a treadmill until exhaustion, once while supplementing with tryptophan and once with a placebo. Total exercise time, perceived exertion rate, maximum heart rate, peak oxygen consumption, pulse recovery rate, and excess post-exercise oxygen consumption were determined during the trials. Total exercise time was nearly 50% greater after receiving the tryptophan than after receiving a placebo. Perceived exertion rate was lower when using tryptophan. The researchers concluded that the longer exercise time could be due to increased pain tolerance as a result of tryptophan supplementation. Seasonal affective disorder is a form of depression experienced by many during the winter months. Symptoms can include difficulty walking, decreased energy, weight gain, carbohydrate craving, difficulty concentrating, decreased libido, withdrawal, anxiety, depression, and irritability. The first order of treatment is often light therapy, but many don't respond to the light therapy, typically because of a mutation in the melanospin gene that's associated with the signaling pathway between the retina and the pineal gland. The pineal gland in the brain is the source of melatonin and it influences the sleep cycle. Melatonin is synthesized from serotonin, which is synthesized from tryptophan. So if light therapy doesn't work, possibly supplementing with tryptophan to stimulate the production of serotonin and melatonin can be effective. Researchers at the University of British Columbia in Vancouver set out to find if tryptophan could help with seasonal affective disorder when light therapy had failed. Patients were treated for 2 weeks using light therapy. Those who didn't respond to the light therapy were treated with 1 gram of tryptophan 3 times per day for 2 weeks while continuing the therapy. The addition of the tryptophan resulted in significant reductions in depression. 64% of the patients in the study showed a good clinical response to the combined treatment with minimal side effects. Recommended doses of tryptophan are 500 to 1000 milligrams per day for cognitive benefits. The University of Michigan Health Department recommends much higher doses. For lowering appetite and craving, 5 grams per day. For depression or anxiety, 2 to 6 grams per day. For chronic pain, 2 to 4 grams per day. And for sleep disorder or insomnia, 1 to 2 grams at bedtime. Tryptophan is a precursor to the neurotransmitter serotonin. Tryptophan hydroxylase is the rate-limiting enzyme that's needed for the serotonin production, and this requires magnesium and vitamin B6 to synthesize the serotonin. Tryptophan is also a precursor to the synthesis of vitamin B3 or niacin, so if you don't have enough niacin in your body, supplementing with L-tryptophan will not effectively produce the serotonin because it will be used to produce the niacin. This also depletes stores of vitamin cofactors B1, B2, and B6. So, supplementing L-tryptophan with a B vitamin complex that includes B3 and B6 and magnesium can help. Some of the clinical trials used much higher doses of tryptophan, however this is not recommended and it's usually not necessary. Too much tryptophan can make you sleepy and it can produce an excess loss of 5-HTP and serotonin, and this can lead to serotonin syndrome. Tryptophan is a normal part of your diet and it's considered non-toxic and safe at recommended doses. In the unlikely event that you already have adequate levels of tryptophan in your body, supplementing could cause problems. Tryptophan can cause stomach upset, loss of appetite, nausea, heartburn, drowsiness, headaches, dry mouth, and sexual problems. Start at the lowest dose to see how your body reacts. When first starting with L-tryptophan, take your dose in the evening to avoid possible drowsiness issues. Low to moderate doses of tryptophan, 30 milligrams per pound of body weight, or about 4.5 grams for the average 165-pound adult, is considered safe and free of side effects. However, most don't need those doses. Don't use L-tryptophan if you're taking antidepressant medications like SSRIs without consulting a doctor. Your body gets some tryptophan from the food that you eat, but this amino acid is competing with other amino acids for transport into the brain. It's competing for the same receptors, and carbohydrates and proteins in your meal can affect tryptophan's ability to synthesize serotonin in the brain. Supplementing with L-tryptophan can make more of the amino acid available to synthesize serotonin and melatonin. L-tryptophan is especially helpful for those with low serotonin levels. Boosting the crucial neurotransmitter can then help to alleviate insomnia, pain, depression, and anxiety. Start with the low dose of 500 milligrams of L-tryptophan per day and take it in the evenings. Then see how your body reacts and how you feel the next day. Then increase the dose to no more than 2 grams per day. Monitor for any side effects. L-tryptophan requires adequate levels of vitamin B3, B6, and magnesium for serotonin synthesis, so a good B complex and magnesium could help. For more information on herbs, supplements, and natural treatments, check out my website.